You're having a colonoscopy. Here is everything you need to know in less than 5 minutes. By the end, you'll be feeling prepared and confident about your procedure. My name's Dr. Hussenbux. I'm a consultant gastroenterologist working in Buckinghamshire, and I perform hundreds of colonoscopies every year. So what is a colonoscopy? It's a bendy tube with a camera at the end. It goes into your back passage and around the whole of your large bowel, otherwise known as the colon. It is the Rolls-Royce examination to look at the inside of your large bowel. So why do you need one? Well, there's a multitude of reasons. You might have bleeding from the back passage, a significant change in bowel habits. You may have a family history of colorectal cancer, or there may be a suspicion that you have inflammatory bowel disease. Whatever the reason, a colonoscopy gives us crucial information about your health. So what's the biggest benefit? We can spot problems early, including inflammation and structural issues. We can take biopsies, and we can also remove polyps endoscopically. We know that some polyps can turn into colorectal cancer if left alone. Like any medical procedure, a colonoscopy comes with some small risks. However, generally speaking, this is a very safe procedure. The most significant risks are bleeding and perforation. However, the risk is 1 in 1,000. For most people, the benefits far outweigh the risks. Now, let's talk about preparation. Yes, the bowel prep is not pleasant, but it is essential. You drink some fluid, and it works as a very powerful laxative to essentially empty out your colon. This means I can see everything clearly. Follow the prep instructions exactly. A clean bowel means a better test. You'll get a call from our pre-assessment team, and we can talk about your medications. If you're taking blood thinners or diabetic medications, please let us know and we can advise you what to do. On the day of the procedure, the nursing team and I will meet you first to explain everything and answer any of your questions. I will also formally consent you. I'll give you some sedation to make sure you're as comfortable and sleepy as possible. Most patients don't remember the procedure at all. Here's something really important. Every bowel is different. Some people have nice straight bowels, some people have twisty-turny bowels. If you have a twisty-turny bowel, you may feel a little bit of pressure as we go around the bends. However, my team and I have strategies to make sure the procedure is as comfortable for you as possible. For anyone who's anxious or has had a particularly bad past experience, I can arrange deep sedation with an anaesthetist present at the Spire Thames Valley Hospital. When you wake up, you'll be feeling a bit groggy but comfortable. I'll give you a full report explaining what I found and the management plan going forward. We can discuss any findings, and I will make a clear plan for your ongoing care. Remember, this test can save your life by catching problems early. You've got this, and I'll be with you every step of the way.